A diver is 40 meters below the surface of the ocean. He has been down for 25 minutes. His air gauge tells him it is time to go up. He is behind schedule. His boat is waiting. He decides to skip the decompression stop and ascend directly to the surface. The decision takes 3 seconds. The consequences will take the rest of his life. This is a second-by-second breakdown of what decompression sickness does to a human body. The physics is straightforward. The biology is catastrophic. Let's start with what is already happening inside him at 40 meters. 1. The pressure. At 40 meters depth, the water pressure acting on his body is 5 times the pressure at the surface. Every breath he takes from his tank is also at 5 times normal atmospheric pressure. This elevated pressure has forced significantly more nitrogen than normal into his blood and tissues. Nitrogen makes up 78% of the air in his tank. At depth, it dissolves into the bloodstream and saturates the surrounding tissue, muscle, fat, joint fluid, spinal cord. This is normal and manageable. The body handles dissolved nitrogen without difficulty, as long as the pressure remains stable. The problem begins the moment pressure drops. At depth, his tissues are holding approximately 4 times the nitrogen they would hold at the surface. That nitrogen needs somewhere to go when he ascends. The question is, how fast? 2. The ascent begins. He starts moving upward at approximately 20 meters per minute, faster than the recommended maximum of 9 meters per minute. He is in a hurry. At 30 meters, the pressure has already dropped significantly. The nitrogen dissolved in his blood is beginning to come out of solution. Not violently yet, but the process has started. At 20 meters, he should stop for a safety decompression stop, 3 to 5 minutes at this depth, to allow the nitrogen to off-gas slowly through the lungs. He does not stop. At 10 meters, the pressure drop is now sufficient that nitrogen is coming out of solution faster than his lungs can eliminate it. The gas has nowhere to go. It is beginning to form bubbles inside his tissue. 3. The surface. He breaks the surface after a total ascent time of approximately 2 minutes. A safe ascent from 40 meters with proper decompression stops takes 20 to 30 minutes. For the first 30 seconds, he feels nothing unusual. He spits out his regulator and signals to the boat. His body appears completely normal from the outside. Inside, nitrogen bubbles are forming and expanding in his blood vessels, joint spaces, spinal cord, and brain tissue. The process accelerated the moment he reached surface pressure. He does not know this is happening. There is no pain yet. There is no sensation that corresponds to what his tissues are currently experiencing. 4. The first symptoms. At approximately 4 minutes after surfacing, he notices his right shoulder aching. Not sharply. A deep, diffuse pain that he initially attributes to carrying his equipment. This is the most common early presentation of decompression sickness. Joint pain caused by nitrogen bubbles forming in the synovial fluid of the joint space. The bubbles expand against the joint capsule from the inside. At 7 minutes, both knees are aching. The pain is increasing steadily. It does not respond to movement or position change the way normal joint pain does. He pulls himself onto the boat. His legs feel heavy. Not weak exactly. Heavy. As if the muscles are working against resistance that was not there 20 minutes ago. 5. What is happening in his blood vessels? Nitrogen bubbles in the bloodstream are behaving as emboli, blockages that obstruct blood flow through vessels. Where a bubble lodges determines what tissue is deprived of circulation downstream. Bubbles in the capillaries of the spinal cord are reducing blood flow to the neurons responsible for sensation and motor control in the lower body. The heaviness in his legs is the first sign of spinal cord involvement. Bubbles are also triggering an inflammatory response at the vessel walls. The endothelial cells lining the blood vessels are releasing inflammatory mediators in response to the bubble contact. This inflammation compounds the mechanical obstruction. The vessels are narrowing from the inside. His blood is also becoming more viscous. The bubble-induced inflammation is causing platelets to aggregate around the bubble surfaces. Clotting is beginning at multiple sites simultaneously throughout his circulation. 6. 12 minutes after surfacing. He is sitting on the deck of the boat. The shoulder and knee pain is now significant, a 7 out of 10 that is still climbing. He tells the boat captain he does not feel well. His vision blurs briefly in his right eye. It clears within seconds. He does not mention it. That visual disturbance was a nitrogen bubble passing through or lodging in the vasculature, supplying his right visual cortex. A transient reduction in blood flow, lasting under 2 seconds. It will not be the last. His skin on his upper chest and shoulders is developing a mottled, marbled appearance, a bluish-red discoloration called cutis marmorata. Bubbles in the dermal capillaries are causing localized circulatory obstruction, visible through the skin. 7. The neurological involvement. At 15 minutes after surfacing, he stands to reach for his water bottle, and his right leg gives way. He catches himself on the railing. He stands again, and the leg holds, but the movement is not fully under his control. Nitrogen bubbles have caused sufficient obstruction in the spinal cord vasculature that the motor neurons controlling his right leg are receiving inadequate blood flow. The signal from his brain is reaching the cord, but the cord cannot reliably transmit it. He sits back down. His hands are tingling. Both of them. The sensation is spreading up his forearms. The tingling represents sensory nerve involvement. The bubbles are affecting the ascending sensory pathways of the spinal cord, as well as the descending motor pathways. Both directions of communication between his brain and his lower body are being disrupted simultaneously. 8. 20 minutes after surfacing. Bob has contributed $100. He cannot stand. His legs are not paralyzed in the complete sense, but they will not reliably support his weight or respond to his commands with the timing he requires. He is nauseated, not from the sea. The vestibular system of the inner ear is affected. Bubbles in the labyrinthine vessels are disrupting the fluid dynamics that the inner ear uses to detect position and movement. His brain is receiving conflicting spatial information. He tells the captain he needs a hospital. His speech is slightly slurred, not dramatically, but the captain notices. Bubbles have reached the cerebral circulation. The nearest hyperbaric chamber is 45 minutes away by boat and vehicle. Every minute at surface pressure is a minute in which the bubbles are expanding, the inflammation is progressing, and the downstream tissue damage is accumulating. 9. What a hyperbaric chamber does. A hyperbaric chamber is a pressurized vessel that can replicate the pressure conditions of depth. The patient breathes 100% oxygen at elevated pressure, typically 2.8 atmospheres, equivalent to approximately 18 meters of seawater. The increased pressure physically compresses the nitrogen bubbles, reducing their size and in some cases forcing the nitrogen back into solution. The high concentration of oxygen simultaneously accelerates the elimination of dissolved nitrogen through the lungs. The oxygen also addresses the tissue damage directly. The areas of the spinal cord and brain that have been deprived of blood flow are receiving oxygen at elevated partial pressure, enough to diffuse into tissue that the obstructed blood vessels cannot reach. The treatment protocol for serious decompression sickness runs for hours, sometimes days of repeated sessions. The bubbles dissolve gradually. The inflammation subsides. The question is, how much permanent damage was done before the pressure was restored? 10. The damage that does not reverse. Neurons that experienced prolonged oxygen deprivation from bubble obstruction do not recover fully. The spinal cord neurons that control motor function in the lower body are particularly vulnerable because they have limited capacity for regeneration. He will walk out of the hyperbaric facility after treatment. His gait will be slightly abnormal. His right leg will have a persistent weakness that physical therapy will improve but not eliminate. The visual disturbances will not recur. The tingling in his hands will resolve within weeks. The cognitive effects, a subtle reduction in processing speed that he will notice before anyone else does, will remain. The joint pain will resolve completely. The cutis marmorata will fade within hours of treatment. These are the superficial manifestations. The neurological damage is the lasting record. 11. The margin. Decompression sickness exists on a spectrum. Type 1 involves only joints and skin. Painful, not life-threatening. Type 2 involves the nervous system, the inner ear, the lungs and the heart. His case is type 2. 4 centimeters of spinal cord tissue in his thoracic region sustained ischemic damage from bubble obstruction. That 4 centimeters is the difference between the outcome he has and a permanent paraplegia. The decision to skip the decompression stop took 3 seconds. The decompression stop itself would have taken 8 minutes. The hyperbaric treatment required to partially reverse the damage took 6 hours across 2 sessions. He surfaced 2 minutes after leaving 40 meters. The recommended ascent, with stops, would have taken 25. The 23 minutes he saved will cost him partial function in his right leg for the rest of his life. The physics did not negotiate, it simply executed.